Hello,
Hey.
how are you?
Good, how are you?
I'm doing well. Are you ready for your 73 questions?
Yeah, you caught me right in the middle of dinner time for the baby, so this will be interesting. But yes, we're ready.
Alrighty. So let's get started. What is your name?
I am Rayonda Bullard.
And what is your specialty?
I'm an OBGYN. I'm a 4th-year resident. Just became one of the chief residents.
Congratulations.
Thank you.
Where did you go to undergrad?
I went to Vanderbilt University in Nashville, Tennessee.
And medical school?
Medical College of Georgia and Augusta University.
Good school.
At Augusta.
Familiar with it. Mm-hmm. Did you take any gap years before going to med school?
I did take 2 years and did a post-bac program at PCOM, Georgia, up in Metro Atlanta area.
Okay. Do you remember what was your favorite part of medical school?
Man, I really liked the anatomy lab, and then I loved getting into the clinical rotations. Those were where I really felt like I got to do a lot more patient care.
Awesome. Looking forward to it. And what specialty did you think you were going to go into on your first day of med school?
OBGYN, so I didn't change much.
Wow. Okay. So not many med students come in leaving with the same specialty they had in mind. So were there any specialties you thought immediately out the gate, not for me?
Dermatology. I just don't like skin.
Really?
Or like sores or anything like that.
Okay. So what first made you fall in love with OBGYN then?
I think just being able to engage in women's health, I knew I wanted to do that from an early age. And so I said, you know what? I need a career that really focuses on that.
Well, you'd be surprised. There's a lot of people that want to go into OBGYN.
Yeah.
And it's a very popular specialty. So for those who are interested, how long does your training take after med school?
It takes 4 years. And then whether or not you want to do a fellowship, most of the fellowships are 3 years as well.
Okay. Did you ever consider getting other degrees like an MBA or an MPH?
No.
No?
I want to be a generalist, so I was pretty streamlined and thought I'd go med school to residency.
Awesome.
Let's head into the kitchen and I can start in mealtime. He's crying.
So, what would you say is the most unique part of your specialty?
I would say just being able to be in many different places in all times of the day. Like, for example, today I was in the hospital doing surgery, then I was in clinic, and then I also was rounding on several patients in our inpatient service. So I love the fact that it's just multifaceted at all times. Are you hungry? Are you hungry?
There he is.
This is TJ.
Hello, TJ.
Here's your toy. We're getting your food ready.
All right. Well, moving on to a kind of fun segment of these interviews, I always like to let physicians try to be the car salesman and sell their specialty. So why should someone choose your specialty?
I think someone should choose OB because you get to really impact women, and we're really in an age where women have been marginalized for so many years, and now we're seeing advancements in the field of women's health and just for women in general. And I think that to be in a field where you can be part of that is very powerful. And then also you get to bring life into the world and be a part of very special moments. And so what better field is there? So.
Well said. Well, turn around, devil's advocate. Why should someone not choose your specialty?
I think someone shouldn't choose the specialty if they're bothered by like weird smells, because we do have weird smells, bothered by a lot of blood, bothered by being in the pelvic area. It's very up close and personal in our field. Are you hungry?
Oh. Are there any stereotypes of your specialty? Fun question.
I think people think OBs are just very busy in that we don't have any life outside the hospital. I don't think he likes this much. Is it good? But we definitely do. And you can have a family, case in point. You can have a career, you can have an outside life and hobbies. And so that's kind of why I was glad to be able to do this interview, is to show that.
That's awesome. Well, the next question was, are any of the stereotypes true? But I guess
You don't like it.
case in point, you disproved it.
Yes. You don't like it?
You're, I guess, still in training. You're chief resident now.
Yes.
Right. So what is the craziest question you've ever been asked by an attending?
By an attending? Craziest question. I don't think I've been asked a crazy question by an attending. It'd be by a patient, but not really by an attending. You mean as far as like workload and...
More like a pimping question.
It might be something on like the history of something, like name the first person who ever did a random procedure, like that type of thing. But it's never anything super weird.
Gotcha. Oh, what does an average day for you look like?
An average day depends on the rotation. In residency, we rotate around different fields within OBGYN. OBGYN is not just delivering babies, it's also doing surgery in the OR, removing like fibroids, removing cancerous cells and pathology as well, like if you're in gynec. And so depending on the rotation, I usually get to work by about 5:30, 6 or 6:30. And then most days the shift ends around 5 p.m. There are some lighter rotations where I'm more so in an office setting where I might be there from like 8:30 to 5.
Gotcha. So more work-related questions. How many patients do you see on an average day?
If it's in clinic for our like attending clinics, it could be very busy depending on the rotation. So with gynec clinics, they could have about 30 to 40 patients in one day. If it's in continuity clinic, then you may have maybe about 12 to 13 patients in a half day.
What is the most amount of patients you've seen in a day?
I would say me personally, 17, but that was with a lot of other people covering like a 50 patient clinic.
Gotcha. So I know you mentioned you don't
like it?
You don't only deliver babies, but how many babies do you deliver in an average week?
When you're on L&D, you might deliver, depending on like the rotation, I would say about a good 16 to 20.
Good number. So what is the scariest delivery situation you've encountered?
I think the scariest for me was actually recently where the mom suddenly, her heart rate dropped way down and she was in 10 out of 10 pain. Oh, he's sleeping. 10 out of 10 pain. And so we got in to do a C-section because we knew something was wrong and the baby was not in the uterus. The baby was up near her liver. So it had been a uterine rupture is what we call it. So it was very, very fortunate that she was there in that moment because it could have been life-ending and life-altering.
Mm-hmm. Well, let's flip it around to a more positive note. What is the most wholesome delivery situation you've encountered?
I really like it when the moms come in with, sometimes they have like these birth plans and all the families there, they're singing a song. And so there was a birth where like both grandmas were there, the dad was there, and they all sang happy birthday. The mood was set. It was just really, really sweet.
That's awesome.
Poor buddy.
Oh, I was going to say, what's the toughest part of your job? But TJ looks like he's had a tough day.
Yeah, he does. I think, honestly, the toughest part is just the 24-hour shifts are kind of taxing. I think being awake for that long is hard on anyone. But I've noticed that even in my 24th hour, if a C-section comes or if a delivery comes or no matter what I'm doing, I'm happy that I'm an OB. I couldn't imagine being in another field doing something else for 24 hours.
Well, adding on to that, what is the most rewarding part of your job?
The most rewarding part of my job is helping people experience like one of the most important times in their life. Like now that I have a son, I remember everything about the moment he came out. And so to be a part of that for other people is just very much a privilege.
Very well said. A little bit more work question related, but very important too. How many hours do you work in an average week?
It depends on the rotation. For residency is much different than the regular private practice or an academic setting where you're an attending. On average, we work about 60-ish, 65-ish hours a week up to like 70 hours, depending on the rotation.
Okay. So what time do you normally wake up?
Depending on him. So I wake up when he wakes up overnight. But if he's not waking up, then I'm usually up by 5:30.
What time do you normally leave the hospital?
Usually the shift ends at 5 p.m. So most days I'm gone by 5:30.
How many hours of sleep are you typically working on?
Pre-baby, 6 hours. Post-baby, 5.5.
That's not that bad.
Yeah.
That's not pretty good.
I'm making it work.
So, how many hours of sleep are you working on right now?
I would say 5.5. The difference is my sleep is interrupted.
So, are you a night or day person?
Neither. Being a 24-hour call person, you're an all hours person.
All hours person.
You learn to multitask at any time.
Gotcha. Well, next question is, do you have to take call at all?
We do take call.
Okay. And how long does it take you to chart at the end of your day?
And that depends as well. I think on a heavy rotation, it might take me 2 to 3 hours to chart. And then some rotations, I finish charting before I leave for the day.
Nice. Wholesome question. Who are you most thankful for on your care team?
I think there's nothing that beats, obviously I think doctors are important, but a good nurse and a social worker. We really don't know how much the social workers do until your patient like doesn't have insurance or doesn't have any ancillary help at home, and somehow they figure it out like 9 times out of 10 how to get your patient home and get the stuff you need to help them.
That's the first time any physician has mentioned the social worker, and I'm very glad you did. That's awesome.
Yeah.
And funny because, oh, he's snoring.
He's snoring.
So, what is the funniest thing you've seen in a patient chart without violating HIPAA, of course?
Being an OB is a very interesting field because you see very interesting relationships. So I've seen like love triangles, I've seen love squares, just a love circle.
Reality TV in
yes,
person.
reality TV in person, which is interesting and sometimes sad at the same time.
But what is the most common medical advice you have to give to your patients?
Wear a condom.
Fair enough.
Yeah.
All right. Well, on that note, we've talked a lot about your life inside the hospital. How about life when you clock out? So what is your favorite thing to do when you are not working?
Honestly, I like hanging out with my son. I think my favorite time post-work is our bedtime ritual. So that's something he and I both share most nights, and it's very special.
Do you ever plan on having more kids besides TJ?
One day after residency. But this one was enough.
Does your family ever ask you for random medical advice?
All the time. We get random pictures, random Google articles that they found, and say, hey, what do you think about this? So it just comes with the territory.
So adding on to that, what is the weirdest question a family or friend has ever asked you?
I've been asked about random like water that could change the pH of your blood and all things like that. But especially in the time of COVID, there's like a lot of hesitancy with the vaccine and just random articles like that. So I think the weirdest thing I got was like a water that changes your pH in your blood.
Any pets?
No pets.
Favorite animal, not a dog or cat?
I would have to say a goldfish.
Goldfish?
Because that's the only other pet I remember having, besides a dog.
Nostalgic. If you could have dinner with anyone in history, who would it be?
In history? Oh, God. That's a good question. Coretta Scott King.
And what would you guys be eating?
Hopefully some good mac and cheese.
So, on top of that, what's your favorite dish to eat?
Mac and cheese.
Any favorite restaurants around here?
People hate me for saying this because, I don't know, I really do like one dish at this particular restaurant. Soy Noodle House has the spicy Thai basil with chicken. Phenomenal.
Very good. Coffee, tea, or soda?
Water? Can I say that?
Yes, because that leads us to the next question.
Okay.
Because I get a different answer from literally every single physician. How much water should you be drinking every day?
I thought they said 8 glasses a day.
I've gotten so many different
I don't
answers
know.
from every doctor. Okay. Favorite meal from the hospital cafeteria, if you have one?
Breakfast, I usually get scrambled eggs, bacon, and diced potatoes.
Favorite healthy snack?
I like making green smoothies with spinach.
Nice. And favorite guilty snack or cheat meal?
Americone Dream ice cream by Ben & Jerry's.
Ooh, good choice. All right, controversial question. Pineapple on pizza, yes or no?
Absolutely not.
Good. Any artistic hobbies you keep up with?
Artistic comedies?
Hobbies.
Hobbies. No, I wouldn't say anything like necessarily artistic. Sometimes I journal, and besides Netflixing and like working out and hanging out with my family, that's about it.
All right. Top 3 music artists.
Well, you got to put Beyonce on there. And then he's controversial, but I love some good trap music, so Future. Mm-hmm. And then we got to throw in some gospel, so Marvin Sapp.
Ooh, that's a good list.
Mm-hmm.
So, one random task you wish you could be better at.
I wish I was better at parallel parking. It's embarrassing.
That's a good task to want to be better at. So, what is the best way that you relax after a long day?
Netflix and chill, i.e. go to sleep. Yeah.
The night in or go out on the town kind of person?
Go out on the town.
Indoors or outdoors?
Indoors.
Beach or mountains?
Beach.
Would you consider yourself more of an introvert or an extrovert?
Extrovert, absolutely.
And do you think that personality trait was a factor in you choosing your specialty?
I think so. Absolutely, it was.
Yeah. So, all right, we're getting close to the end. I only have a few more questions left, but these are more reflective questions.
Mm-hmm.
So, first one, what did you think you were going to be when you grew up as a kid?
I thought I was going to be a fashion designer. That's the first thing I can remember saying. And then it switched to lawyer and then doctor.
Yeah. Is there a different specialty you think you could have done?
I maybe could have done general surgery. I thought about that. And I also thought about pediatrics, but general surgery, that was next on the list.
Yeah. If you didn't do medicine, what do you think you'd be doing right now?
I've really gotten into real estate. Like, I'm very interested in like properties and flipping houses and stuff. So I'd be interested in doing something like that.
Okay. And as anybody that has gone to the medical field knows, this is not an easy route to get to. So were there any times you doubted you would make it as a doctor?
Yes, and it's one thing I've learned is that it's not a one-time thing. It comes back, and you have to just tell yourself you made it this far and say, hey, I can do it.
Very well said. Now, if you could change one thing about the medical field right now, what would it be?
I would change the past faults that the medical system has made against like minorities, and because I think that has built a lot of distrust that I've seen like in my community personally, and that causes a lot of barriers to care. So I think I would change the past and hope that it would have made a bit more of a bridge for healthcare for minorities.
Awesome. Now, what can a medical student do right now to prepare to go into OB?
I think just be open to learning. I think it's also good to be well-versed in the issues, because patients aren't just like a sickness, they're also whole people. Yes. And looking at not only are you treating a woman, but you're treating a mom, you're treating a sister, a teacher. And so I think knowing like the current events is important for being a doctor as well.
That's awesome. So if you were to go back, would you change any of your experiences that got you to where you are right now?
No. I'm happy.
All right. And finally, question 73. We're at the end. What would you say to the aspiring OB physician right now?
You can do it. It's a difficult road. It's a hard road. You'll question if it's worth it, and only you will know the answer to that. But there's no doubt in my mind that you have what it takes.
That's awesome. Well, Dr. Bullard, that is all I have for you. Thank you so much for your time.
Absolutely.
And let you get back to tending to TJ.
Yes. Good night, TJ.
Thank you.
You're welcome.